Hey guys, ECRG here, and today we're going to be talking about how I stay organized in clinical research. Hey guys, ECRG here, and today we're going to be talking about how I stay organized in clinical research. And this is a huge topic, and I'm really upset that it's been so many videos until now and I haven't talked about it yet. So here we go about how to stay organized in clinical research. This is going to be more of an overview video, and then we'll delve in further videos about more detailed ways you can stay organized in clinical research. But if you're new to the industry or new to the working world in general, it's going to probably be a big shock to you how many emails you get on a daily basis. Because yeah, we had email in high school, yeah, we had email in college, but it's not really used the same as it is in the working world. And it may be a bit of a shock for you once you get there and realize you're going through hundreds of emails a day potentially and sending out so many emails. But like all things, the more you do it, the better you get at it and the more efficient you'll become at it. So you just got to be patient, be self-aware, understand what you're good at, what you're not good at, and work a little bit on the things that you're bad at and continue to double down on the things that you're good at. That's kind of how I view things. So without further ado, the two main areas that people struggle with organization is one, email. And this is a big deal because, like I said, you're going to be kind of shocked if you're new to the industry how many emails you're going to be getting. And it's very important for you to have a system so you're not missing things when people tell you to do things, and you're not missing out on important information. And once again, this is going to take time. You're not going to just be able to do this overnight. But at least here we're talking about it, and hopefully us talking about it will help prepare you for that when you enter the working world, for whatever field you're in, or if you are in clinical research. And so email, there's really a few ways to keep yourself organized. Now, one of the things that I like to do is use the flag feature. So basically, the flag feature is a feature where you can flag something, so when you're scrolling through your email box, you know where it is. Or you can also, in Outlook at least, you can search for all the flagged items. So I know all of my flagged items are stuff that I need to attend to. And so that's what I use. I use the flagged items. Now, and I hate to be stereotypical, but I've noticed a lot of the girls I work with in the industry are incredibly organized. I don't know what it is about them, but they are just really good at being organized. Like, I've looked at their folder setup. They organize lots of different folders for their inbox, and I typically don't do that. I grew up never writing down my homework assignments. I was just able to remember them, and I was never like the best note taker or really good at organization. So I've kind of adapted my method of organization in the working force to kind of supplement what I already do. So I keep a lot of things in my head already, or I know if I just mark it, I know to come back and check it later. Whereas people may be setting up reminders in their calendar, they may be setting up reminders in their email, they may be doing all types of things, organizing them into different subfolders. I don't do that. I kind of do what is needed to get the job done, rather than all of that organization and then not even really needing the organization in the first place. I kind of do what is necessary to get the job done. And either way works, but you just got to know and be self-aware what works for you. So I really like that flag feature in Outlook, and I use that a lot. I also use the tab feature, so I keep tabs of things, everything that was like really good or really good said about me. So when you do your reviews later on, I mark with a green tab, and then red, I use the red tab feature, and that's different than the flag feature, but I use the red tab feature for things that I'll be coming back for that are important, that I'll be referencing over and over and over again throughout the course of the year or throughout the course of the trial. So those are the two main things I use in email to keep track of things. That flag feature is my life, and that has all the important things I need to go back to, and I use that pretty much as a task manager. So instead of writing a to-do list, I use that flag feature as a task manager, so I know to go back and I have those tasks to complete. Now, in clinical research, it is very rare that you get through everything you need to do, especially if you're fully allocated like I am, or like I was. 3, 4 protocols at one time you're managing. So there's always going to be something for you to do. So don't freak out about that. Sometimes my tab list my flag list gets really long and it can seem overwhelming if you look at it all at once. But you've just got to be able to prioritize and understand what needs to get done now, what can wait until next week, and what can wait for a couple weeks from now. So, and that's really where the calendar comes in at that point, managing your time. So the second big organization hurdle that people have is managing the calendar. And this is a big deal because you're going to have meetings throughout the day. You're going to have things that you want to remember throughout the day. And I use my calendar kind of, if I need to be reminded about something, then I'll put it in the calendar. And, Outlook has a feature where, you can automatically get reminded 15 minutes before or 5 minutes before. So really, I just type it in. Let's say, I have to update the contact list, study contact list. So I'll put study contact list update in there. And then that's that. 15 minutes before that time, I will get a reminder from Outlook. Oh, we got to update the study contact list. So I use that feature a lot, and I've been using it more and more throughout as I was getting better in the career. When I first started, there weren't that many protocols that I was on. So there really wasn't that much stuff I had to remember. So I wasn't using it as much. But as I got more and more experienced and they put me on 4 protocols at a time, then I've got to start remembering stuff. Like that's a lot to keep all in your head at one time. So then I had to start using the calendar and inputting those little to-do tasks, especially the important ones that had to be done. So if I knew CRAs had started their PSSBs the next week, then I better make sure that their sites are in metadata CTMS. So I had to put that in the calendar because that has to be done this week so that all those sites are in there and they're ready to go when the CRA needs them. So that's just a quick example of how I use the calendar. So that's pretty much it for the calendar. I use that as to-do lists. Other people may do more things with that. They may literally put everything in the calendar. I know some people who track their time by the hour and what tasks they do for each hour, and they use the calendar for that. I don't really do that. It would have come in handy a couple of times, specifically when, working overtime and you need to justify why you need that extra overtime hours. So it would have been helpful to have a list of everything you've done with the time allocations to it. But really, more often than not, I kind of melt the numbers to kind of work so I don't have to do that anymore. So I kind of, adjust the numbers to my benefit there, just slightly, just tweak it slightly. And so I kind of make sure that doesn't happen. But it happened earlier on in my career a few times where I'd, work over the allocation time, and then they'd want me to justify why I worked over it. So then I'd have to go look back at my calendar and through all of my emails, like, okay, what did I do at this time? And it was just a pain in the butt. So it would have been nice to have the list of everything I've done already, but that's only happened 2 or 3 times, and now I just avoid the situation completely. And that's pretty much that. So some people use their calendar to track their time as well, and you can do that. I think it takes too much time, but to each his own. So there's lots of different ways you can use the calendar, but the email by far is the most important thing that could be shocking to people that are just entering clinical research or any new job. And being able to understand how to maintain that email and be organized with your email is a skill that's going to happen over time, and it's a skill you can develop. But it's good to go ahead and start practicing now. If you're in college, start practicing that, and it'll just pay dividends for you over the long run, over the long haul. So those are the 2 key things about organization. We'll do a tutorial on how to create folders in your email, because in clinical research you have to do something where you have to manage the shared mailbox, and what people normally do is they manage that manually, and you can add folders in there. Okay, site communication, okay, client communication with the sponsor, okay, vendor communication. You can add folders in like that, and then they're going to have their each subfolder. So if you're using, say, Telelingua for a vendor, or you're using some other company, FedEx, for printing, then you'll need folders in there with all the communication in there. And a lot of people do that manually, but there's also a way to have it automatically do that. So we'll talk about that in another video as well. So that's pretty much it for organization. Those are the two main things you need to do. So if you have any comments, comment down below on organization. What do you do to keep things organized for your daily workflow? What helps out with you? Put that in the comments. Don't forget to like, share, subscribe. Hit that notification bell right next to the subscribe button. YouTube does a lot of funny things with unsubscribing people from the videos, so I'm sure you probably dealt with it with some of the other channels you subscribe to. So make sure you hit that notification bell. That would help us out so much, and in that way you'll be able to know whenever we release videos. So like, share, subscribe, guys. Email us eliteclinicalgroup@gmail.com for all inquiries. You want to be part of the resume review program, we do that. Email us there. And that's it for today, guys. Take care.